Hi there, Andrew with Zang Physical Therapy here, and today I want to talk about the three most important things that you can do if you have neck pain. Neck pain is one of the most common reasons that people seek out care from doctors, be it their primary care, be it an orthopedic, and then also seeing other health providers such as physical therapists, acupuncturists, maybe chiropractors, massage therapists, you name it. So people go to find treatment any number of places, which is fine. The end goal is to help people feel better. But if you do have neck pain, there are a couple important things that you should know. And one of the most important things to know is, except in very select circumstances, imaging of your neck is not necessary. It's not going to tell any professional how to treat you better. It is an easy thing to do. Standard x-rays aren't super expensive, but they are a minor expense on the surface. But in the big picture, imaging leads to many other things, such as injections, which costs a lot of money, possibly surgery. And why it might lead to injections and surgery is because people are looking for solutions. Injections are going to be painful in and of themselves because they're sticking a needle into a small space, and that isn't necessarily going to solve the reason why. It may just modulate the symptoms for a short period of time. Surgery, because when they take a picture or an image of anybody over the age of 40, it is going to show age-related changes. What they're going to tell you is it's arthritis, and I can't tell you how many patients have come in telling me that their orthopedic said they have the worst looking spine of anyone they've ever seen, or they have a spine of a 70 or 80-year-old, and this person may be 35 or 40. That is a horrible thing that the medical profession does, and it needs to stop. So if you've been told it, please run as far and as fast as you can from the medical provider who told you that, because it's just not true. Unless you actually happen to be 80, then that's fine. Back to the main thing. So, imaging not necessary. What should you do if you have neck pain? Okay? Number one, move your neck. Don't limit your neck movement because it hurts. When you don't move your neck because it hurts, or you think it is going to hurt, it is going to stiffen up. And then after it stiffens up, it's going to be more sore to then move it side to side or up and down thereafter. So you don't necessarily have to move your neck till you have excruciating pain. You want to move your neck into a little bit of discomfort. A little bit of pain is perfectly fine. You're not harming your spine or anything else by moving it. Okay? So movement is key. It will help you to loosen up. And as you loosen up, you're going to feel better. Number two, don't allow yourself to be in one position for more than 30 or 45 minutes. So this is especially important for individuals who work at a desk, any kind of office work. So you're typing at a computer, you're reading documents, you're answering phone calls, maybe you're driving a lot for work. Change positions. By being in one position for a very long period of time, things stiffen up. It's low levels of strain that build up and build up over time, and then things really hurt when you start to move. So if you're in an office setting and you can get up, every half an hour to 45 minutes, get up, do a quick lap around the office, go get a drink, go to the bathroom, just do something, okay? If you have learned some exercises to do to loosen up, perfect, do them. If you don't feel those exercises are helpful, then maybe you don't do it. Maybe you move on to number three. So if number one and number two don't help you out within 7 to 10 days, go seek some help from a profession who's not going to order imaging, isn't going to tell you have to take medications, and isn't going to be advising surgery, except in very extreme and very rare circumstances. Get help by seeing someone like a physical therapist. We can help to get you moving better by loosening up those tense, tight muscles. We can help loosen up and restore movement in any neck joint or upper back that may be a little bit stiff and limiting. We can teach you exercises to get you moving properly again. We can teach you what to do at home, at the office, when you're in your car, stop to the stop sign or stoplight, obviously, to help to keep yourself loose and moving and feeling better. Okay? Neck pain is not something you have to live with. The longer you live with it, the longer and tougher it is to overcome it. So if you get help quicker, chances are you're going to overcome it a little bit quicker. And once you know how to manage it, if something pops up later on down the road, months or years later, you'll know exactly what to do to overcome it quickly. And if not, then you know the person to come back to that will help you get moving again quickly. So hopefully this has been helpful. Again, the 3 most important things to do: move your neck, don't stay in one position for more than a half an hour, 45 minutes, and then go get help from a physical therapist if you haven't gotten better with number 1 and number 2 within about 7 to 10 days. Okay? If you have any questions, absolutely happy to continue this conversation because it's important that people get themselves moving and that they don't have to live with neck pain. Again, it's a very common thing. So there are a lot of individuals out there walking around or sitting in office right now who have it and just don't know what to do. There's a lot to do for it, and you don't have to suffer anymore in pain. So again, if you want to continue the conversation, send me an email, put something in the chat bar. I'll get back to you. Otherwise, I'll talk to you later. Have a nice day.